Gout is a type of arthritis characterized by sudden, intense pain, redness, heat, swelling, and tenderness in the joints. Gout usually affects the large joint of the big toe, but symptoms can occur in your feet, ankles, knees, hands, and wrists. Attacks typically last about 5 to 10 days. Gout is caused by the accumulation of uric acid crystals, a waste product that's formed from the breakdown of purines, substances found naturally in the body and in foods such as organ meats, asparagus, anchovies, herring, and mushrooms. So far, scientific support for the claim that any natural remedy can treat gout is limited. Vitamin C. Some evidence suggests that vitamin C may help to reduce uric acid levels. In one well-designed study, 184 people took either vitamin C supplements 500 mg per day or a placebo. After 2 months, uric acid levels were significantly reduced in people taking vitamin C but not in the people taking the placebo. Although this study suggests that vitamin C may help prevent or treat gout, many more studies are needed before we can conclude this. People with kidney disease should consult their doctor before taking vitamin C supplements. Vitamin C increases the absorption of some types of iron from foods, so people with hemochromatosis should not take vitamin C supplements. Vitamin C in doses over 2,000 mg per day may cause diarrhea, gas, digestive upset, or interfere with the absorption of vitamin B12. Vitamin C supplements may raise blood levels of aspirin and acetaminophen. There have been rare reports of vitamin C interfering with the effectiveness of the medication warfarin, Coumadin. Vitamin C may also increase the effects of furosemide, classified as a loop diuretic, and the antibiotic tetracycline. If taken together, vitamin C may decrease the absorption of propranolol, a medication for high blood pressure and heart conditions. Speak with your doctor first before combining any of these medications with vitamin C supplements. Cherries. Cherries are a popular home remedy for gout. The amount usually recommended is anywhere between half a cup and 1 pound of cherries a day. They are either eaten or blended and then diluted with water to make a juice. Cherry extracts are also available at some health food store. Although cherries are a fairly well-known remedy for gout, there is almost no evidence that it can help. One very small study examined the consumption of cherries on uric acid levels and inflammation. 10 women consumed 2 servings, 280 grams, of Bing cherries after an overnight fast. 3 hours after eating the cherries, there was a significant decrease in uric acid levels. There was also a decrease, although not statistically significant, in inflammation. Diet. Although most uric acid in the body is made from the metabolism of naturally occurring purine, eating foods rich in purines may also contribute to elevated uric acid levels in the body. The third National Health and Nutrition Examination Survey, which used data from 14,809 people in the United States, found increased uric acid levels among people who had high intakes of meat and seafood. On the other hand, total protein intake was not associated with increased uric acid levels. Dairy intake was associated with lower uric acid levels. Specifically, people who drank milk 1 or more times per day, or who had yogurt at least once every other day, had lower uric acid levels than people who didn't consume yogurt or milk. Another study involving 47,150 men with gout also found that intake of meat and seafood were associated with an increased risk of gout. Total protein intake and consumption of purine-rich vegetables, such as asparagus, were not associated with an increased risk. Dairy was associated with a decreased risk. Using natural remedies for gout. Due to a lack of supporting research, it's too soon to recommend any alternative medicine for gout. Supplements haven't been tested for safety, and due to the fact that dietary supplements are largely unregulated, the content of some products may differ from what is specified on the product label. Also keep in mind that the safety of alternative medicine in pregnant women, nursing mothers, children, and those with medical conditions or who are taking medications has not been established. You can get tips on using supplements, but if you're considering the use of any form of alternative medicine, talk with your primary care provider first. Self-treating a condition and avoiding or delaying standard care may have serious consequences.